Are you hiding your depression behind a smile? Would you like to learn characteristic of perfectly hidden depression and discover helpful ways on how to properly deal with it? Then you're in the right place. Today we are interviewing Dr. Margaret Rutherford, and she's going to talk about some of the ways to identify and deal with depression that may be hidden. And stay towards the end because I have a special at the end and some great announcements. Please give us a thumbs up if you're able to hear and see us. Welcome to Happy and Healthy Mind. If this is the first time you guys are joining us, my name is Dr. Rozina, and I have been serving as a medical doctor specializing in psychiatry, a best-selling author and speaker. Um, in this, I started this program because I truly believe that a lot of suffering can be prevented with simple mind training. So we bring practical tools in these programs so you can avoid suffering unnecessarily. The purpose of this program is education and not treatment. So please consult your healthcare provider for specific advice. Our mission is to bring health and happiness to more than 1 million people. So if you find value, please like, subscribe, and share so more people can benefit and live happier and healthier life. And if you're joining us live today, you can put your questions in the comment section and we'll try to answer them. If you would like to join us in future in live program, you can text the word joyful to 38470 and we'd be happy to send you reminder and resources link. And so today our guest is Dr. Margaret Rutherford. Hi, Dr. Rutherford.
Hi.
Thanks
So
for
glad to
joining.
be here.
Um, Dr. Margaret has been a psychologist in private practice for over 25 years and is the author of the book Perfectly Hidden Depression: How to Break Free from Perfectionism That Masks Your Depression. In her book, she shares a lot of clinical uh, cases and techniques, and we'll learn some of those today. So before we ask Dr. Margaret a question, I have a question for you guys attending live. Please share. Do you uh, do you know anybody who may have depression or anxiety that is hidden? You just have to say yes or no. Okay. So, Dr. Margaret, how did this topic become important in your life?
Well, actually, Rosina, I have been blogging longer than I've been podcasting. I've been blogging since 2012. And back in the spring of 2014, I was just sitting in my sunroom and thinking about some of the patients that I had seen over the years that, one, I had not initially diagnosed with depression, but two, would certainly never say to me when they walked through the door, I'm depressed. In fact, usually they were like, I'm not real sure why I'm here, but there's something in my gut telling me something's wrong, or I'm anxious, or my partner says I need therapy, or something like that. But the similarity between all of them is that they were highly perfectionistic. They carried a lot of shame and fear, and that was driving the perfectionism. But the other thing that was so notable, they could be talking about something that most of us would consider traumatic, like a rape or abusive parents or something, and they would be smiling. They would be saying, "Oh, well, that was a long time ago, and it's really not important." So the work became to connect them with those emotions. But I wrote about these people in a post called I just grabbed the term perfectly hidden depression out of the air and said, the perfectly hidden depressed person, are you one? Well, the post went viral. And I had never had a post go viral before. And I was pretty shocked. At the time, I was writing for HuffPost, and I put it on there. And I had forgotten that I had left my email address on the bottom of the post.
So your email box got filled.
Well, I got hundreds of emails. How do you know this? It's like you're inside my head. I think my wife has this, whatever. So I trudged through all those emails and said, I'm thank you so much. And this is so I got really interested in the topic and started looking at both the academic literature and the popular literature. And of course, I found Dr. Brene Brown's work on vulnerability and shame and perfectionism. But even she didn't really uh, talk about or focus on the specific link between perfectionism and depression. The academic researchers did, and they were finding that as perfectionism rates go up, so were suicide rates, and they were correlated with one another, especially with one specific kind of perfectionism. So I contacted them, talked with them, and I just said, well, this book has found me. I'm going to write a book called Perfectly Hidden Depression.
That's wonderful. Great, because it can help so many people. Like I call it like high functional depression. And how do you differentiate from a high functional depression means a person who has depression, but they're able to still function at a higher level. I think the hidden depression is a little different. So can you explain the difference?
It is. It is. I think people who have high functioning or smiling depression will see themselves in the book as well. But you just said it. They know they're depressed. They can go down the symptom criteria list diagnostically for depression, and they go, yes, I have this. I'm hopeless. I feel helpless. I have foggy thinking. Sometimes I think about killing myself. I don't enjoy things I used to enjoy as much. All symptoms fit them. Maybe therapy even, but they somehow have the ability to slap a smile on their face and go about. And not that people have more severe than that aren't have some sort of weakness. They don't. But for some reason, those people are able to do that. Actually, the people that I'm most concerned about, well, not I'm very concerned about, are the people who don't know anything is wrong. They think the way they're living is in life, one is successful. They look fulfilled. They have great friends. They are very busy in the community. They volunteer. They work hard. They raise their kids. They work in church. They do all these kinds of things, and they look very, very productive and engaged. But there's something wrong. They cannot, like those people I was telling you in the office, they connect with emotional pain. They have literally compartmentalized that pain so long that started most likely in childhood that it has become an unconscious process. All of us drive, and we can remember laughingly when we first started to drive, we had to focus on 10 and 2, and everything was very conscious and thought out. And now we get in our cars and we don't even think about it. That's what happens with perfectly hidden depression. It becomes an unconscious process. And what you're doing, Freud said therapy is all about bringing the unconscious to consciousness. And in some ways, that work is very typical with perfectly hidden depression as well.
So, how do you diagnose if a person doesn't even recognize the symptoms? Um, how do you diagnose this hidden depression?
Yes. Well, as I said yesterday when we chatted, I'm not smart enough to think that I came up with some diagnosis that no one's ever thought about. There were writers of researchers in the 1990s who were talking about the dangers of perfectionism, and that when you have a perfectionistic person in front of you, you really need to be attuned to that idea. So as far as diagnostically, I think of it as a syndrome. You don't diagnose codependence, which is probably the most well-known syndrome. You say, oh, I see you as having or being codependent. Perfectly hidden depression is the same way. And what I did was I came up with 10 traits that I thought were very reflective of someone, their behaviors. What do these people look like out in or in their own private lives? What do they look like? So that clinicians, mental health professionals, could have a rubric to use to say, well, gosh, this person fits this trait of the syndrome, and this one, and this one, this one, and so when the cardiovascular community years ago, when they were trying to find out if someone was likely to have a heart attack, all the research was done with men. And so they lost this. They would say, "Oh no, you don't have any kind of cardiology problem," and women heart attacks. And until we understood the symptom picture for a woman with a potential for a heart attack be different than a male, then all of a sudden, women, got diagnosed with cardiovascular disease. Well, the same thing I think needs to happen in the mental health profession. We need to understand that sometimes if we follow our rigid little checklist and say, no, you don't fit this, so you're depressed, then we could miss people who actually could very well die by suicide.
Yeah.
It's a
So
serious problem.
yeah. So it may really help to know what are these traits that would make somebody have at least consider, if someone of the audience is hearing, what kind of traits they should look for.
Sure. Well, again, the major trait is lots of perfectionism, high, not constructive perfectionism, not perfectionism that is innately fulfilling, not perfectionism that brings joy, trying to do well, but perfectionism that is fueled by shame or fear. Maybe they had a parent who screamed at them, "You'll never amount to anything," or maybe they grew up in a family where you simply didn't talk about painful emotions. You were sent to your room. You never heard the adults in the family talking about anything but being grateful. These people are highly responsible. In fact, uber responsible. They take on all kinds of tasks, and they don't take one off their plate when they add one. They just pile it on. Analytical. They don't like doing emotions very well, and they stay in their head. They are they discount trauma, they or deny it completely. They also, again, don't have language to express painful emotion very well. They are really good friends. They're the person that is on your doorstep when something happens and you need a friend, but you don't know much about them. These are people who like a lot of control, and they worry, but they're not thought of as a worrier because, again, that's a vulnerability, right? If you're a worrier, so you don't reveal that, but you worry, and then how you take care of your worry is to grab more control, which causes more fatigue, which causes, more shame, which causes more need for control, and so there's this cycle. These people count their blessings. They don't see that even a blessing an underbelly, and so they'll even say to you, "Well, I always look on the bright side." John Kabat-Zinn calls it rigid positivity, and that's a great term. These people are also, they usually are doing very well in the workplace. What do we like? We're perfectionists for us, right? I know I want my tax attorney to be a perfectionist. I want my doctor to be that. And, they get a lot done in a little bit of time. And so they're rewarded in their work life. The problem is they don't know how to do emotional intimacy. And then the last one is they frequently do have, or can certainly have, actual clinical diagnosis. Usually it's some form of anxiety. It's an eating disorder. They can have problems with a substance because they're trying to escape. So you don't want to, you can have generalized anxiety disorder, or OCD, or panic attacks, and have the syndrome of perfectly hidden depression all at the same time.
Yeah, that makes sense because, as you were saying, some of the initial traits, it seems like, okay, I also have it. I know a lot of you.
Right.
So we are a little bit perfectionist. We a little kind of are more positive. We focus on gratitude. And so these are kind of positive traits. So what makes hidden depression have the negative consequences? And so what I heard you identify was not accepting of your emotions, not having the emotional language to express, minimizing something, you're feeling it but you're trying to hide it, and you're focusing so much on taking care of other people that you don't take care of yourself.
Yeah.
Am
You
I
remember
kind of on right track?
you may not even feel it. I mean, you don't know how you feel. You're just kind of lost. But the it's balance. I think that if you're responsible, that's a right. But I'm talking about her responsibility. I'm literally talking about people who and the patients that come in to see me that have this or identify with it. Have makes it sound like a diagnosis. They identify with it. They'll say, well, I was contacted to be the chair of this non committee to raise money, and I'll say, so what are you going to give up? And they're just astounded. What do you mean? What am I going to give up? I'll just stay up later, or I'll get up early, or nothing comes off. So it the lack of personal boundaries.
Mm-hmm.
They don't, they focus on accomplishment and tasks.
Yeah.
It's done.
It would help. It would help if we can you share an example of someone typical with this kind of syndrome?
Sure. In fact, this young woman was the first person who ever came into my office and said, I heard you talking about perfectly hidden depression, and I think I have it. But then the second thing she said to me, as she kind of, kicked her foot and looked down, she goes, but I can't talk to you about much of anything right now. I'm way too uncomfortable. And I said, okay, you're in charge. You're in charge. Well, come to find out, over about quite a while, about a year and a half that I saw her, every week or every other week. As a child, she had been assaulted physically by her father, not sexually, but physically, to the point where she had to have several surgeries. But all her mother did was she got divorced, but her mother never talked about her father. She knew nothing about her father. The whole family just didn't talk about anything like that was painful. She took ballet, and she became very perfectionistic at that point. Her mother also had anorexia, and she developed anorexia. So when she got to college, what she had learned was, I must do everything perfectly. She was engaged to the perfect guy. She did have great friends, but they didn't know that she struggled with the anorexia, especially. And she gradually told me that, again, very gradually, because this is scary people. Perfectionism has been their friend. Perfectionism has been the way they have accomplished things. And so when I say, well, maybe it's better to have another strategy, it's like you're asking about my best friend. But what had happened was, it turned out her was abusing her physically, and sometimes sexually, that he knew a secret about her that she didn't want anybody to know, and that she finally very tearfully, or not even somewhat tearfully, told me about. And he had been blackmailing her that, she better marry him. And she, about a year into treatment, but she was going to marry him. She ended breaking off the engagement, and after that, and then we worked toward accepting that, and she began to eat more normally and all that kind of thing. She told me two things when we were sort of ending therapy. One, she said, I had a plan to kill myself when I walked in your door. I was going to kill myself 3 weeks after I got married. And two, she told me what the secret was, and she said, I didn't think anyone could know that about me, and I would be accepted. I felt like I would be. And she said, but I told you, and you just held those emotions with me, and said, you don't know the gift that you gave me. And so she'd been around in shame, and she was a wonderful young woman to work with. And I actually talked to her again last year, and she reiterated that beginning to confront her own perfectionism and her own shame had freed her. And it was interesting, too. She went on a trip with her mother, and her mother's rules had been, when they went on a car trip, that women don't eat. Men can eat. I don't care how long it is, but women can't eat on the car trip. And she got in the car, and she said, Mom, I'm hungry. And your mother goes, now, we don't eat on car trips. We girls, we don't eat. And she said, Mother, I'm hungry. Please stop the car. So she was making really big changes in her life.
Wonderful, wonderful. That's really inspiring, that somebody's life was not only transformed but saved from losing a really potential life to suicide. So, thank you for doing that. Um, I would love to kind of share some of the tools with our audience that if they are having something like this, or they know somebody, what are some of the steps they can take so that they can get the proper help if needed, or take care of themselves better.
Sure. I had written the book as a descriptive book. I was just trying to describe this syndrome, and I thought that's where it would end. And the people who eventually published it, New Harbinger, said, "Oh, no, 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 we need a treatment strategy." And then they looked at me and they said, "And you have 2 weeks." I went, "Oh, 2 weeks." So what I did, I came up with the 5 C's of healing or treatment. And the first one I've already really been talking about, which is consciousness or mindfulness. Consciousness that you become aware that your perfectionism is destructive, not constructive, and that you can recognize that in yourself and accept mindfulness. Begin being aware of what and how your whole life is geared around having other people think of you as highly successful and productive, and keep you don't let anyone in on the secret. The second stage is commitment, and there's some specific commitments that are difficult for someone with perfectionism or a need for control. One, they'll feel like they've, what do you mean I go to, what do you mean I let someone on all this? This has been a big secret for me. And you'll often start with something too hard because you're a perfectionist. There are over 60 exercises in the book that lead people, and they start out fairly simply. For someone who's never delved into their emotions, they're not simple. But and then I had a woman tell me, "Oh, well, I just skipped all that stuff because I've been at work." And I went straight to the trauma timeline. And she said, "I couldn't do it." And I said, "Because you have to do all these others to prepare yourself for that."
Yeah.
So there's some specific commitments that are in the book that are hard to confront or hard to do.
Yeah.
The third stage is
So before we move on, I'm just thinking that maybe these exercises would help people who are perfectionists, who may not have developed depression yet, but
yeah.
maybe it would help them to prevent reaching to that point.
Rosina, you make an excellent point, because a lot of perfectionists will tell you, "Oh, I'm not a perfectionist." And I do all the time.
Well, I'm happy to share I am.
And so, but that's why that consciousness phase comes first, because it is about, I must recognize that my perfectionism is not my friend, and I'm using it as a taskmaster. Um, so actually, a lot of people will tell me, and I wish I'd put more of this in the book, but I can recognize I need a lot of control. Not be a perfectionist, but a lot of control. And so these are good exercises for anyone.
So
Actually, they're
people who at least recognize that they are either control freaks or they are perfectionists,
right,
they
right.
they can benefit from these exercises. And let me ask the question to the audience right now. Um, do you have any tool that you use to mask your emotion or suppress your emotion? Because a lot of people use smile or laughter to hide, but I know that there are people who also use anger to hide, or they kind of isolate to hide their feelings so that nobody recognize that they are feeling what they're feeling. um, so please put in the comment section if you can identify one tool that you may have used to mask your feelings. And here, let me ask Margaret, is masking really bad? If I have a patient who's on a customer service position, and so when she was feeling depressed, she had hard time controlling her tears, but it is necessary part of the work. You cannot just start crying in front of people whether it is customer service, whether it's in other colleagues. So there is certain boundary that you have to maintain, and for that you have to mask your emotion. So is that masking bad? And if it is not, how do you differentiate that masking from not feeling emotions at all, so that numbness that you're talking about?
Realization of, I mean, if I had won the lottery this morning, I was still, I'd agreed to be on your show. And so, you know, if I'd won $1 million, I'd still be here. If my dog had died this morning, I would still need to be here. I would need to compartmentalize those feelings. Again, the distinction is that and that's an ego skill. The distinction is that it's rigid, it's constant. People will say things like, when you said, how do you hide it? I've had so many people tell me they just tell people, oh, you know, I don't ever cry. I'm just not. Or if I started crying, I'd never stop. And they laugh it off, like you said. So it's about, I think you hide it through like any means you possibly can. People tell me, again, I did interviews and I've had to tell me, I asked them why they would even talk with me. They were sort of revealing to me their secret. And they said, I've been so tremendously lonely all my life. I never want anybody to feel like that. It's a very lonely kind of way to live.
So it's the difference in the severity and rigidity, like you said.
Exactly.
So it's okay to mask when it is appropriate to mask, but it has to be balanced with being able to express when it is also appropriate to express. Like you said, these people don't even express to their close friends or family because they are not comfortable even sharing it with their close friends and family.
Right. There may be one person that knows them like that, but a lot of the time that person is not someone who lives in the same city they do. It's a friend from high school that lives, you know, far away, so they can risk letting that person know a little bit more about them. But yeah, and so the third stage, confrontation, and that's basic behavioral therapy. If you want to write down the rules that you're following. And, you know, I can never cry. I always have to try my best. I can never be caught without a smile on my face, whatever that is, and really begin, or maybe it's a rule, I want to stop at stop signs. I mean, some rules need to follow and we want to follow, and they actually they're very fulfilling to follow. Then there are other rules that we were either told we had to follow as children or we chose to follow as children that are now non-productive in our lifetime. And you can begin to say, I don't, like, you can confront those rules. I don't want to live my life this way anymore. And my own life is that there was very, she was overly protective, highly overly protective. So I learned to just risk her knowing it and get, and that was how I do a lot of the things I got to do, because I would tell her, well, God, I've already tried out for the play, or I've already done this, or I've already done that. And she'd go, oh, okay, well, but guess what? That strategy, that rule, got to be an adult, not effective, because it turned out that I was a very impulsive adult, that I didn't think through some of my decisions because I just did it. Yeah. And so that was a rule that needed to change in my lifetime.
What about the step 4 or stage 4?
Step 4, action, and that has to do with that trauma timeline we were talking about a few minutes ago, and that is about going back through your life and acknowledging with compassion, what happened to you that was wonderful and brought you joy and you were proud of, but also the things that were hard. Now, this is really difficult for anyone with true trauma in their lives. So sometimes this part of the work needs to be done with a therapist. Okay, I say that throughout the book, actually. So that's learning how to connect with that pain and to label it as such, and to know it exists and accept it exists, and to be able to actually feel it and talk about it. The 5th is change. I don't know about you. We're both mental health professionals. But what I've learned in my 25 or actually 28 years by now is that hope from inside to connect the dots, very helpful. But, real hope is from behavior change. When I'm doing something differently, when I'm feeling differently, when I'm, choosing it, that's where you get hope, because you see yourself changing. So I have specific ideas in the book about how to change each one of those traits, again, slowly and carefully, with self-compassion.
That's wonderful. So the five steps you defined was consciousness, commitment, confrontation, connection, and change.
Yes.
Great, thank you so much. And so you had uh, you have a gift to share with the audience. So can you tell us what would be the gift for them?
Well, I think that a mantra that I have made up in my own life, actually, and I believe is, I say it often to my patients, is that your strengths do not define you any more than your abilities do, nor do your abilities define you in your strengths. I have 3 letters after my name. I'm a PhD. I'm very proud of that. I've also been married 3 times, and I'm not proud of that. That was chaotic and one of those impulsive things. And I've now been married for over 30 years, but the first 2 were voices on my part. Their part too, actually. And so those are both facts of me. Be judged on either one. Some people, health professionals, are a little wacky. I'm not to be praised because I've been married 3 times, but neither of those facts define me any more than the other facts.
So let me ask the audience, if you guys have any questions at this time, please put it in the comment section and we'll try to answer. And meanwhile, let me ask Margaret, can you tell us about how people can get your book?
Sure. It's on Amazon. It's at Barnes & Noble. Go to your bookseller, local bookseller, who probably business. I've heard it's in the public library at this point. So you can go and get it wherever you can. You also can go to perfectlyhiddendepression.com, and that'll take you to my website. You can reach me at drmargaretrutherford.com. That's my site. I have a podcast as well called the Self-Work Podcast, and I would love to welcome your listener. But that's kind of where I'm on
Wonderful.
today. I have a column on psychology today.
And I'm excited that you are also sharing one free book with people
Sure.
who. So if you guys want to win the chance of winning her book, please go ahead and comment below this video, and we'll pick one lucky winner who would get a copy of her book. And like always, you can get all the resources shared in these programs, and by texting us the word joyful to 38470, or joining our Facebook group, Happy and Healthy Minded Dr. Rosina. And before we go into the special, I want to just ask Margaret, do you have any last take home message?
Well, I think that the antidote is one to hidden depression is self-acceptance. And again, my definition of self-acceptance is what I just said. Your strengths don't define you any more than your vulnerabilities, and vice versa. So I wish everyone well, and you can come, you can email me at askdrmargaret at drmargaretrutherford.com if you have any specific questions, and I'll be glad to. I can see that some people have written some things, so that's wonderful, and I'll send you the book if it would be helpful to you.
Wonderful. Thank you so much. And so before I go into the special, let me make another announcement. Guess what? We have been doing these programs for 1 whole year. So
Yay!
HM is going to be 1 year old, and the next program we are going to celebrate as a celebration, and we have lots of prizes and raffle and things going on. So remember to join next time, and watch out for all those posting, because You can either participate in a contest of submitting a video message and win the prizes, or answer the questionnaire that would be in the link in the comment section, and it's all on our social media. So participate in those contests, win the prizes, send us the questions, let us know how this year of HHM has helped you, or what difference it has made in your life. And if you have any questions that you would like to address in our future programs, we'd be happy to address them and plan our next year accordingly. And so now it's time for the special. And so, for special for today, I'm going to answer a question that a lot of people ask: how do we decide when to seek treatment? You see, depression and anxiety is so common. Everybody experiences some depression and anxiety. How do you decide when to do the self work and when to seek professional care? So I have 5 points that you can consider before deciding. So number one is, how severe are the problems or symptoms? Okay, so everybody feels a little depressed when something bad happens. Everybody feels a little anxious before, if they are worried about something, before an exam, before starting the Facebook live, before doing anything new. There's a little bit of anxiety, which is normal, and it helps you prepare for things. So it depends on how severe the things is. So severity. Then second thing is duration, how long it has been going on. So if a little some you have some depression going on for maybe a day or two, it may not be the depression. But if it is going on for more than 2 weeks, so the duration matters. The third thing is how it is interfering in your life. So is it something that is preventing you from being able to function at work or school or in family? And in some ways it is affecting your functioning. That is the third consideration. The fourth consideration is trigger. Are there things that really trigger your anxiety or depression? Like, when you go to a party and suddenly, like, you see somebody and you get really triggered, or simple things. So then you start avoiding. And so then the fifth thing is how overall it is impacting your life. If you're depressed and you don't enjoy going out with your friends, enjoy watching the movies that you used to like, and so your life starts kind of shrinking and the quality of life starts going. And so those are the 5 points to consider. If things are kind of crossing those boundaries, that means the normal depressed and anxiety is now changing into something clinical, and you really need to seek help. And the one point that you want to remember is that health and wellness is a continuum. It's not like switch on and off. Okay, so illness and wellness is a continuum. Sometimes you are at the optimum level of wellness, and sometimes you are at the severe level of illness, but most of the times you are somewhere in between. So you want to take steps at every stage to be at the optimum level of wellness. If you don't have any symptoms, you want to take steps to prevent things from happening. If there are and work on optimizing your health and happiness, and that has been the goal of HHM, to give you the tools for optimizing your health and happiness. If you are having some symptoms, whether in terms of depression or stress or anxiety or other problems, but it is not severe enough to reach the clinical level, then you need to take more steps to prevent that stress from becoming more severe. And if you do have the symptoms that are meeting the criteria, then you want to seek treatment so that it doesn't get further worse. So those are the 3 levels of prevention. I call it primary prevention, when there is no problem; secondary prevention, a little bit problem, you're at risk but not severe; and the tertiary prevention, when you are having the illness, then you take the steps from getting it worse. And all these things I'm going to be talking about in my upcoming book, Dodging Depression and Anxiety. And I hope it would help a lot of people. take these preventive actions. Please share with me any questions, any that you would like me to address in the book. If you'd like to be part of the early readers group, please share, and I'll continue to share more and more tools in these programs in future. So let me leave you with this question today. Are you going to choose to hide your suffering and not take steps to get better? Or are you going to choose to become conscious and mindful of what is going on and take steps to live your best life? On that question, stay safe, healthy, and happy. Till next time. Thank you, Dr. Margaret.